Good evening. Welcome to the Board of Health meeting of June 18th, 2019. We're going to, oops, actually I have to read this, sorry. This agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed also be brought up for discussion to the extent law prohibited by law. And Laura is recording. No? Okay, awesome.
Anybody else recording?
Yep, I
Nobody's
was gonna
here.
say, well, Laura's not recording, and nobody else is here in the audience, so. All right, the first item on the agenda is reorganization of the board.
And I claim the seniority here, being the member for the last 5 years. I take the pleasure in nominating Dan Martinson for the chairmanship of the board.
I'll second that.
I'll third that.
I was just gonna ask for discussion.
Yeah.
All in favor?
Aye.
Aye. Thank you. Any nomination for vice chair?
I take the privilege of nominating Chris Daniel for the vice chair.
I second that.
I'll third that one again.
Any discussion? All in favor?
Aye.
Aye. Nomination for clerk?
Well, I take again the same privilege to nominate
You want to do that
Judy.
again? No? You
Yeah, I
want to do
did.
that again?
Ju-
No, okay.
What are the
Judy Teller for being the secretary for
Yeah,
the
I'll
clerk
second
for
that.
the board.
You
Yeah.
second
Mhm.
it? Any
As long as
discussion?
you're up for it.
I don't know
If
what
you
the
don't-
responsibilities are.
It's not that hard.
Okay.
Not much.
This is what you used to do?
No.
If I could sail
Yeah.
through 3 years of that in
Yeah.
the first time I thought you could be
Okay.
doing it, don't worry
All
about
right.
it.
Any discussion? All in favor?
Aye.
Aye.
I'll help you with anything you need,
Okay.
promise.
All right.
Good guy.
And then the other two members become members.
Members.
All right.
yes.
All right, I guess I'll continue. I was planning on handing it off to somebody else. Okay,
Congratulations
thank you
to all of the candidates.
for sitting here. So if the other board members don't mind, we'll take the food inspection report. Tom Curran is here, and he'll give us update.
Good evening, everyone. So as you can see by the report that I've given to everybody, this is a date range beginning April 1st until the present. And 72 full sanitary inspections were conducted in that date range, a wealth of which are temporary food events. As you know, the farmer's market is back up and running. We had the Against the Tides event last weekend. So needless to say, we've been very busy. We have the carnival coming into town this week. Wanted to point out that we did answer 3 complaints. One of them was an anonymous call from Mill Pond Rest Home regarding a bathroom that we found to be adhered shut. When I got there, that has since been rectified. The back bathroom door was screwed shut on the first floor. That's since been repaired. Another one was Mark, Agent Orm, informed me of elevated coliform plate counts for the McDonald's ice cream machine. We responded to that and found that the restaurant was not sanitizing the machine properly. It was in poor sanitary condition, and I cited the establishment for that, and they took care of that issue. There was also some other things with crowding of old equipment in the restaurant. We're working with the owner to build an exterior storage shed, so he's not using the interior of the restaurant to store out-of-use equipment and parts. He owns multiple McDonald's locations, and he was kind of using that as his boneyard, so to speak. So we had a discussion about that, and that's not going to happen in the future. Shaw's, me and Mark were both at a seminar, and we received a phone call from Shaw's regarding a flare-up on the roof with a ventilation HVAC unit on the roof. The manager noted some slight noxious odors in the vicinity of that in the prepared food section below where that was, and took an initiative to dispose of all exposed foods in that area. I did a follow-up visit, and that unit has since been repaired. Also, I don't know if you received or were aware about the directive from the state issued last week for the CBD in foods, and it's no longer allowed, although hemp seed oil is allowed. So it's been kind of a gray area up until this point. So for now, apparently that is not something that's generally recognized as safe as an ingredient to be added to food. And I also wanted to point out that I assisted Mark on a housing inspection as well while he was on vacation. And we both conducted a follow-up together on that, since he's the expert when it comes to that, not me.
Tom, you're learning and you're doing a good job, so thank you for covering in that respect.
Thank you.
And this report is great.
Oh, thank
I
you.
think it's very
Yeah.
helpful.
Thank you. I just saw it, so if I find something that's more interesting to add on to this, I'll let you know about it.
Oh,
and then
okay,
we can
please do,
definitely-
yeah.
That'll be helpful to everybody else. And I also point out that there are several new temporary events. One of those was Showcase India. Thank you for both of you for being there
Oh,
and
yeah,
coming through. Good report. That's good. Very helpful and builds confidence for the local people that the health department is taking care of them.
Thank you.
Yeah.
It can be added that it's great when you can work with another person as a team member, and Tom's that team member. It helps in a tremendous way when there's a need to have more than one person. Sometimes one-on-one isn't always the best situation. In many difficult situations, it works best to have at least two people there. So he's been a good team member throughout, and I appreciate Tom's service.
Yeah, but still,
So much.
my broken record is still on. The more time for the food inspection. We need it. We need it.
Tom, that's a lot of inspections in a pretty short amount of time. What's the average you spend on these things?
It varies. Some entail more specialized processes depending on what, the complex cook steps are in the establishment. Obviously, something like a CVS retail food store where I'm only, focusing on, pest control issues or refrigeration, wouldn't take as long. But if I'm doing something like AFC sushi at Shaw's, which you have to go through make sure that they are following their process, the HACCP plan that they've submitted to us, that they're following it verbatim, testing the acidification level of the rice, cooling the sushi appropriately before it's presented for retail sale, and hygienic practices surrounding the preparation of it. So it varies, and we've been working with Dolce de Leche on their plans to open their business in town, which is wonderful. But we've had to do plan reviews as far as the HACCP plan that they've submitted to us. That's another example of something that's more detailed and complex, because it's a.
I don't know if everyone knows about that food manufacturer that's moving in, Dolce de Leche. You may want to just explain what they're doing.
Oh, sure. Yeah, Dolce de Leche has been a business that's been working with us, and they've been participating in the farmers market, and they've been at the Corner Spot for several years now. They're a family-owned business. We're pleased that they're going to open a place here in town. We're working with them to open he's working to open a bulk production facility to produce gelato. Initially, he wants to work through us to get his catering license, and then he's also going through the process with the State Department of Public Health to get his wholesale licensure to be able to sell that product to other businesses. But initially, I think his plan is to sell the product at retail and use it to use the facility to produce the product for that location here in Ashland, and then his other location, I believe, is in Framingham. So he's very well versed. I believe he's by trade a scientist.
He's a biochemist, yeah.
Yeah, a chemist. So he definitely knows what he's doing.
I know him personally.
He's worked very closely with us, developing his plans and making sure that there's no cross contact of allergens in the production. That the transport piece of it is covered, and he's bought some commercial freezers to ensure that the product stays frozen during transport, and also when he's fetching ingredients, a lot of the ingredients he'll go get himself at like Restaurant Depot, and as long as he has the means to transport that in a safe manner, then that's a reputable vendor to purchase those products from. So, and also his layout, making sure that he has the appropriate facilities in place for warewashing, and procedures documented for the clean-in-place equipment. Usually these type of operations have like a pasteurization machine that fluctuates in temperature to heat the product up to incorporate the ingredients in it and then cool it back down again. So it can be very extensive, but it looks pretty streamlined what he's given us so far. So hopefully he'll be able to get that off the ground soon.
Thank you, Tom.
Thanks. Any other
Go ahead, Madam Chair. You were gonna say exactly what I was gonna say.
Any other
And
questions
it's
for
your
Tom?
position. I apologize.
Don't worry, I'll need your help, all your help.
It's okay.
I guess we still are far away from reaching to 2 inspections per year per every facility, so we need to reach that by adding more time, or,
I was gonna say, Tom, I'm assuming that the board will probably talk as it gets closer to budget season as well as permit season about reviewing the fees. So that's why reports like this are helpful for us, so we can just look at them to know what you're doing, so when it comes time to look at the fee structure, make sure
Yeah.
we are in line with, the demand, the need, as well as your time. So
Sure.
reports like this are gonna be very helpful for us when it comes, maybe thinking like September or something, so we'll probably have you back and just
Oh,
go
for
over the
sure.
fee schedule to make sure that we're charging, not too little or not too much for things, so, for food establishments.
it's good. Thank you.
Anything
Thank
else,
you.
guys?
Thanks,
Tom, thanks for coming in.
Oh, thank you so much.
Thank you.
You're more than welcome to stay, but feel free to go home if you would like.
I'm sure he's got some things to do, and then he'll probably head home.
Yeah, gotta satisfy the wife's cravings. Being
That's why
pregnant
you know
with
so much
twins.
about
There we go.
All right, moving on to number 4, Mark?
Just, sorry.
No, that's okay, you can, Laura gave us all in the binder on
Yeah.
number 4, the
Framingham
Framingham
regulations.
regulations.
You should probably call number 3, even though there's no citizens, and just recognize that there aren't any citizens here.
Okay, so I just wanna recognize that nobody's here for citizens' participation tonight.
And Diane, while we're on that, may I ask too that at this point we introduce Kaylee Teagan, our intern,
Okay.
to the TV audience, so they know who our intern is for the summer. Kaylee started about 3 weeks ago now, Kaylee, give or take. And she will be coming back to do a presentation of her project for the summer. She goes to Boston University School of Public Health, and she's in there, thank you, Tom, for her master's. And she's part of an internship program run both by the DPH and I believe BU interact with each other. And she's our 7th student for the 7th summer that we've been able to have here to help guide them, because if there's any experience that you can gain, I always believe it's through internship. You can go to school all you want, which I have been there, but you learn in the field as well. And she's been through quite a few things so far. So she's picking up on public health emergency preparedness, housing codes, some other issues with rooming houses, and again, it's always nice to have a partner with you when you're doing inspections that are difficult, especially a housing code where you're going into someone's home. So I've appreciated having her by my side to help out and to learn as she goes along, and she'll be doing both. She'll be shadowing me as well as she'll be doing her project. So I welcome her again, and I wanted the board to know who she was, and she's listening in tonight, and she'll be back to present.
Welcome.
Thank you, Mark.
Welcome,
Good
Kaylee.
luck with everything, yeah.
Mm-hmm.
And now you want to
Okay.
So, Sam Wong, he's the health agent director over in the town of Framingham, was at 2 meetings ago, I believe. He came to present what Framingham has done with their tobacco regulations, and to thank Ashland, because basically the basis of their regulations was from the Ashland regulations. And he also wanted to note that he's trying to promote a couple of tweaks they added to it in every town that he's visiting, and mostly within our region especially. We're a 9-town region, from Natick to Framingham to Marlborough up to Hudson, there's Sudbury, Wayland down. And we had a regional grant for tobacco compliance, and we're also trying to get everyone to have the same regulations so that it's easier in respect to public discussion, to let our vendors know we're all in this together. We're trying to make this equal across the board within our region. A couple areas that they address, we have not addressed in our regulations. One is distance for an adult use tobacco store. They require that if anyone's interested in opening an adult use tobacco store, that there's not a concentration of tobacco sales within the area. And also probably to, in some respects, protect other businesses that can only sell certain tobacco products. An adult use tobacco store can sell flavored products, smoke accessory products as well. They're the catch-all, but you can only be 21 and over, and you cannot receive a retail food permit. So there's no reason to go in there for food. Your business is to sell tobacco products and not have youth in there seeing advertisements and all that. The other one is something too that that they're looking at, and it's the name is called a smoke accessory sales permit. And on that one, it's accessories to, such as paraphernalia related to inhaling tobacco products, marijuana, as well as CBD products into the human body. And that store is limited to just that. They cannot sell tobacco of any kind. And so the whole reason they adopted these is to limit the amount of each, the adult use and the smoke accessory unit. So I bring this to the board for your consideration, because there will be a time, we get calls now and then. I'd say every other month, an interested party will call here asking about these type of uses, and it could happen in the future. So I bring that to the board's attention now, and maybe we want to look at these. Diane and I were chatting a little bit about the fact that this is a tough time to be adopting any changes to our proposed regulations for January 1st, but to have a discussion period with the vendors, it's best probably in September, we thought, because in the summer people get scattered about.
Gives us time to work on it.
Yeah, this is a perfect time to work on it, yes.
But if I may jump in, I've done a little homework with this.
Okay.
Because I've spent a fair amount of time with these tobacco regulations
Yes.
when we were revising them. In terms of what you mentioned with the 500-foot rule, unless I've read it incorrectly, it's actually more rigid than that in Framingham's regulation.
What
That
page
fi-
are you on?
I'm in the Framingham code on page 10.
Let me get to that too.
And that is item D, second from the bottom. If I'm reading this correctly, not just an adult-only tobacco shop, but any tobacco licensee can't be within 500 feet of another tobacco licensee.
Yes, and that was for the concentration,
Yeah.
that is correct.
So that's
Yeah.
just something to think about
Yeah.
if we wanted to add that to our regulations.
So D references tobacco product sales permit within
Yeah.
500 feet.
Right.
So that's people who sell
Right.
nicotine deliverable products,
Yeah.
not,
Not just an adult-only shop.
okay.
Yeah.
So, because I know when we tried to, I thought it was for both shops. So
Right.
this actually is only for the two.
It's yeah.
Okay.
As long as you have a permit, can't be within 500 feet of another permit.
And obviously, the present vendors would have to be, I didn't mean to
Right.
jump in, Ron, but they would
Correct.
have to be
No,
grandfathered.
Right.
Because we do have concentrations here
Yep.
and there.
Yeah.
Grandfather with the condition that
Well-
any one of them lose or surrender it, then that grandfather class goes away.
For the current,
Exactly.
Yeah,
yeah, we'd
I
have to
would
work out those
suggest.
details, right, for,
I
Something-
suggest.
something-
similar to what we have for the school, 500
Oh,
feet.
definitely
Yeah.
that.
So
Yeah.
that-
We have 500 feet to the schools right now.
That's already in there.
I mean, just as far as an additional vendor goes, that's a relatively moot point, right?
Yeah.
Because we're not giving out any
And I'm
more
bringing that,
tobacco licenses,
that's what I'm gonna
so-
bring up. Interestingly,
Yeah, so, I'm not saying we shouldn't add it
Right.
just for completeness sake, but
I said,
we
I
don't.
said the
we're-
same thing to Mark
Yeah.
today, I go, it's
Yeah.
kind of, that's not as important as some other things to me in these
Yeah.
regulations, because it's a mute issue if we're, so just for clarification, we're kind of all over the place here,
Yeah.
Judy. So there's new
Right.
new regulations taking effect, you know, we've already, the board has already voted, and it's going to
Right.
be
January
taking
1?
effect January 1.
Okay.
That
Isn't,
if
isn't
a
there
permit-
one permit that's being,
Well, good point.
that's the
And
one that
is-
might be issued or not issued, we don't know yet, so.
And if they decide under this year's regulations to locate where it was located, that's within 500 feet of another tobacco vendor. But again,
We have
it depends
a
on when
limit
this
on how many
starts.
tobacco vendors.
Because as of January 1st, with the proposed regulations presently in place in Ashland, if something doesn't happen with that permit, it dissolves.
Correct. So the
Within the
500
second of
feet is-
January 1st.
Right.
So,
and that also brings into the idea that currently there is not an adult-only tobacco retail shop. There was someone talking about it, right? If that does not come to fruition by January 1st, it will never come to fruition under the regulations that come in,
Correct.
because there won't be a permit available.
Well, there won't be a tobacco sales permit there, but, and I'm not necessarily
Yeah,
suggesting we create it,
Right, unless
but
an
we could
existing.
do it as they did it, what is it, sorry, I lost my page, they're calling it
An adult only.
smoke accessory sales permit.
Right.
So if we
I'm gonna bring
establish,
those up in a second. But yes, and the only caveat would be if an existing permit holder changes their business in a retail location. So we'd have to probably include some definition, which isn't in our current thing, for an adult-only shop, which they have. And I've started working on that stuff, and I'll, as we get a little further in, I'll present some of that stuff. But going back to Diane's talk about smoke accessories. Now, Mark, if I remember what you had mentioned in previous meetings, currently they can be sold in convenience stores, and there is not an age limit as to who can purchase them. Is that correct?
that is correct.
Okay, so
That
is
doesn't seem right.
there an
well, I was
option?
gonna say that,
It doesn't, right.
That's why I think Framingham addressed it.
so that's smoking paraphernalia, anybody of any age could walk into a retail establishment
Pipes,
today
bongs, et cetera.
and purchase those,
So,
which was a
do-
little eye-opening.
Is it
Yeah,
within, it's clearly
So that's
within our
another
authority
potential
to change make it an age requirement, but,
Correct.
I mean, can we choose to ban smoke accessories
The
completely?
banning I would pass by an attorney first. We could pass it by our Mass Association of Health Boards
I
attorney.
wouldn't do that unless we all agree
Yeah,
as a
because now
committee,
you're running
as-
into
as a
free
group that we
trade.
want to look at that.
Yeah, I think
Okay.
we
Well-
can pass that by
Yeah.
her.
I understand why we, had the other thing, but if there's smoke accessories and smoking marijuana is legal in Massachusetts, why would we be banning products that you can use with that?
Well, I'm not suggesting that we ban, I mean,
Mhm.
my thing is,
Just not
I
allow
learned that
them?
it was, it could be of any age.
Right.
My thought would be to require you to be 21 years
21
of age
plus.
Okay,
to purchase any
Okay.
Smoking paraphernalia.
okay, cause that's the
That's
age for,
Because that's the age
Yep.
of purchasing.
great,
Right. So the
okay, that
question,
makes sense,
Right.
okay.
what I'm bringing up is the questions that we'd have before us is
Right.
whether or not we want to ban it, if not, whether or not we make it 21 plus, and then what type of locations.
So just,
It can
I
be
just
sold
wanna make sure
at.
Judy understands, so what also tonight is, obviously we have to sit at a meeting and talk about this, so what we're going to do is, at the next meeting or whatever, we're gonna actually allocate enough time or a meeting that we'll sit here and just go over the regulations.
Okay.
So we'll agree to disagree and then come to a set of regulations that will move forward, have council review and so forth, and then have a public forum
Okay,
for
and that's
adoption.
the draft that we,
This is Framingham's right now, we haven't.
We're just reading through
What
loudly,
Chris
that's
is
all.
about doing is he'll take it
I'm
and,
kind of thinking out loud,
right.
is what I'm doing, to
Okay.
kind of give you some
And
things.
so we'll literally have a meeting, I'm assuming we're not doing it tonight, but sit
Yeah.
down and just go over everything from top,
perfect,
bottom.
okay, together,
But because you might have a different thought than we do and vice versa, so, and then we'll come up with a draft that
Okay.
we'll look at again.
all right.
Yeah,
I just wanna make sure Judy understands,
Yeah.
we're kind of all over the place.
Yeah.
It is.
Okay.
He just got,
Try to follow.
just wanted a clarification from Chris.
Yeah.
When you said that the current tobacco people converting into an adult use,
Mhm.
we are going to issue permits for them, it's going to be a separate permit for them.
Well, that's, I was just gonna bring
So
that
that'll
up
come
and
under the new
ask Mark.
regulations, one. And why would a salesperson convert that to adult use only because he wants to sell the mentholated and other flavored item? That's when they want to convert it, right?
So
Right,
an
but he
example,
would-
right? An
He would be,
example.
he would be risking his other businesses because he has to close
So,
that one.
but here's an example, right? So Ram and Mark, please jump in to make sure I'm online. So Farmers Ram Market, they currently hold a tobacco license, a tobacco permit. And they closed their convenience store business, but they still have the property.
Yeah.
So if they were to come in.
They did relinquish it.
Oh, they did relinquish
You're
it.
talking,
Okay.
you're giving a
So
hypothetical,
let's
right?
assume they didn't relinquish it, okay?
Yeah,
And this
okay.
is hypothetical. And they still had a lease on that building, and they said, well, the convenience store thing didn't work for us, but we wanna open up a retail tobacco shop, okay? And,
Just
yeah.
because I wanna make sure I understand, so it actually would be called a smoke shop, because the
An
way
adult
framing,
use smoke
well,
shop, right.
Smoke
a
accessory
smoke
shop.
accessory shop cannot sell tobacco products.
Correct, correct.
So if they chose to have an adult accessory sales permit at that establishment, they cannot sell
They're mutually exclusive.
traditional combustible cigarettes.
Yeah, they could only sell paraphernalia for the inhalation of the various CBDs, marijuana, and so forth.
Or,
It's the adult use tobacco store that gets the entry of selling smoke accessories and flavored products and tobacco. Again, both have to be 21 and over, but
Right.
you get, I guess,
That's what I was
more
kinda referring to, actually.
opportunity if
Yeah.
you're looking at it as
Use
a
the wrong
vendor.
words.
no, but, yeah, it's,
And I'm on I-1 and 2, you get more opportunity if you're an adult use tobacco store than if you're a smoke accessory. But the smoke accessory store can only sell smoke accessories.
Okay.
The whole purpose,
I
I
see.
believe, was to get that out of the convenience stores. Yeah, and that's what I think they're trying to do. So if you go into a convenience store, you're not looking on a shelf and there's all these accessories and you're 10 years old, you know. I think that was their intent.
So the other piece of it is they've added a smoke accessory sales permit as a
Yeah.
separate
Correct.
permit.
so,
And they've limited the number, and I
Three
don't know
of it,
if, I don't know if their strategy was that it's approximately 10% of the people with tobacco permits, but, you know, that would be another thing that we'd have to contemplate. Do we want a separate
Right.
permit for smoke accessories?
Right.
So the
many?
locations, locations have to be exclusively different ones, tobacco
Yeah,
and this one. So
but
they
I also think it
cannot
will,
be the same store or same property.
well, if, the way Framingham has it now, if they do an adult accessory,
Right,
you could have accessories and tobacco products.
Ah,
Smoke accessories are just the accessory part, not any tobacco.
Like a vape shop. They sometimes call them vape shops and
Yeah.
so
Well,
forth.
yeah, and,
Right.
the one that was looking at here in town, that's what it's called, I think it's called like Vape City or Vape Smoke City or something like that, it's right
Yeah,
in
but they
Holliston.
sell the
I don't know
products
if I'm supposed to
there,
say that, but.
which
Um,
they use it for vaping.
So if they're selling the products there, then
Yeah, and then that.
they
that-
start to divide that.
Because an adult accessory can sell flavored tobacco products, or no?
No, they
Okay.
can't sell any
Cannot be.
tobacco at all.
Right.
Adult only tobacco
Adult
shops, that's what you
accessories,
saw.
yeah.
It seems like,
But can they sell flavored,
Yes,
Yeah.
yeah.
but they can't sell menthol?
who would wanna,
Yes.
who
They
would wanna
could.
do
They
that?
can sell
in-
anything.
Okay.
in today?
it's a little bit
That's
tricky, right?
that's-
It's a little bit
Nobody's
tricky
gonna wanna
because
do
there's a
that.
tobacco
Right.
shop
Yeah.
and
I
then
mean,
there's an
if somebody
accessory
can
shop,
sell the
right?
tobacco and the
And so-
accessories.
And then there's an
some of the
adult
accessories,
accessory,
who's
which
gonna
they
do
can
it?
sell all of everything,
Which
including
makes it
what,
confusing.
including what
Puts
we're
them-
eliminating as
Right.
of January first.
Exactly.
It's-
And,
there's
well,
probably
the
not
other
gonna
thing too, the other piece of the
Who would
puzzle
do that?
that we'd have to think about, right? If we do
can't imagine
decide to create a separate permit for smoke accessories, and we quantify how many of those permits are out there
just gonna wait till the full discussion.
based on whatever formula,
Before I jump.
and existing permit holders are eligible for them, we have to figure out, well, let's say we have the 18 existing permit holders, and I'm gonna pick a random number, let's say 5 of them are eligible to have an accessory permit. Does that mean we have to make it 5? Or do we pick 2, and how do we pick 2, which of the 5 to get preference?
Now, when you
That
did
kind
your
of thing.
research on the last round of tobacco regulations, do you already have like other communities around us that
I
like to
do.
do like, put together?
I basically have the
I
regulations.
mean, I would suggest he be the person to go through all these things and come back with us.
Well, that's what I was just gonna say, I mean,
Because
you've
you
done all the
already done the
research, if
other
you
one.
wanna
Yeah.
let us know what other communities,
Yeah, yeah.
specifically, cause
Yeah.
some of these things I don't think we talked about at all, like, I
Yeah,
don't remember.
no,
accessories,
absolutely,
so-
I wanna make sure it's clear that these are some of the things we're gonna be confronted with.
Absolutely.
Right.
No, it's great.
I mean,
I
you
think
spent
it's-
umpteen amount of time, and I think
Yeah,
you're the right person to go
Yeah,
through and
sure, no, I'm fine.
digest it
Yeah.
and dissect it
Yeah.
to us.
yeah, no,
Exactly.
yeah, I mean, that's why I'm bringing it all up.
Sure.
Yeah, I think Framingham's trying to control the amount of vape shops in Framingham.
Yeah,
And
I
usually a
mean-
vape shop doesn't have a tobacco permit.
They've got the extra burden
Yeah.
of marijuana as well, so.
Yeah. So, and that's where that smoke accessory, it wouldn't make sense to even go for one.
Right.
But,
It wouldn't.
but there's vape shops and they want control in those vape shops, so that's how they're doing it, in my view.
Yeah.
And then the adult use is the part where you can sell anything, but you can't, well, they both can't have anyone but adults in there, so.
Yeah, I get it.
And that's more controlled, so it's like going into an adult retail store of some type, so it's a
But I
controlled
guess that
situation.
additional thing with, so it's gonna take everything out of any convenience store, right?
That's right.
You can't sell food and those accessories.
You're going in there to buy tobacco.
Right.
Basically, or an accessory to help
Yeah.
inhale the
So-
tobacco.
Hmm.
But, yeah, that's a good idea, maybe combine
Yeah.
our thoughts. And
Yeah, if you'd be willing to do that.
Yeah, absolutely.
Great. Anybody have anything else on it? No? Too good.
Okay. Mark, when you talk to Wong, thank him for referring these
I will.
material to us, and I appreciate it.
You wanna go over the budget review and?
Sure. So we're at the end of our year, our fiscal year, and I did speak with Brittany, our financial rep, related to any funding that we might be able to collect at the end to consider the purchase of a refrigerator. We were fortunate to get a grant provided by KG, thank you KG for the freezer.
Yeah.
And this is for the childhood vaccination program. We already have a vaccination refrigerator, but at the state level, they require a specialized refrigerator above and beyond the one we have, which is a medical refrigerator. So because of the cost of childhood vaccine that's given to us by the state for free, but they have extra requirements for this storage of these vaccines, and it means additional cost. So I'm waiting towards the beginning of next week to see if we have any, hopefully no issues with the landfill, no issues with nursing, because that's where the unforeseen usually comes from, is if we have an unusual case or if we have a problem with the landfill. But right now, things are okay. You know, as of last Tuesday, I was a little worried because we had a certain case that was a false positive, so that was with the nurse, so that was good to have a false positive, because this case could have taken up a lot of time. And I can explain what the case was. It was hepatitis A. If you have a hepatitis A case, and it was a person that had been involved with traveling through a restaurant or through a public facility, you gotta try to collect all the people that were there and vaccinate them. So thankfully, that would have been a very lengthy process. And that's why I was very concerned that we had no money left. If anything, we'd be asking for money. So Brittany said next week, see what we got left, and we might have enough to purchase a refrigerator. Obviously, our lines for salary are all controlled lines, and we're at 94% of our end of the year, so we'll see where we stand. The entire budget's at 91.9%. There's a little wiggle room in the contracted services related to the landfill. That's where that little wiggle room is there, as I know the conditional to no issues.
Could you tell me where the landfill is, please?
Yeah, it's on Howe Street. It's a
So is
cap.
that where they just put the solar?
Yes, it's a cap landfill. They just
So what problems would we have there if we let someone put
What it
solar
is
on
is the landfill continuously, as well as all landfills, let out gases.
Uh-huh.
Methane usually is the main gas that's let out from the digestion of all that waste below. It just turns into methane and other products. And so we're required, as all landfills are that are capped to, as well as landfills, to check groundwater as well as gas that escapes from the landfill through various monitor pipes. And we check those monitor pipes for gas monthly. And some months we see elevated levels of methane, and there's levels that we have to watch. So we put in a vent system, we being the town of Ashland, per the recommendation of DEP, to try to vent that gas before it gets past the boundaries of the landfill. So if you ever get a chance on Howe Street, if you go by and look behind the trees they just put in on the little bit of a artificial mound, there's little twirly gas vents. Those are releasing the methane.
Okay.
So out into the atmosphere where it should go and not under the ground. Some of the serious concerns that caused changes to the codes on methane escaping from landfills was they found at one point someone got hurt, if not fatal. A methane can build up enough where a spark can pop a manhole cover right off the rim, and it went through a car, I think, and it was a fatal issue. And at that point, the state said, we're changing the codes, and that's why they get stricter on the levels of methane you can see. But at this present time, we have one area, and we're not for sure what's causing. It's a slight elevation to the lower explosive levels that they changed when that happened with the cover popping off the rim. And that's the one we're watching, but our consultant feels it's still okay. It's better than it's ever been because of this new gas collection system. But that's why I caution always, and that's why the town has given a little wiggle room with the budget for that. Because if we had to, we may have to add an additional vent or two, or whatever the state recommends. The state's been a good partner in helping us work on any issues of this nature.
So the solar that was placed on it poses no threat to this methane gas and the heat of the solar panels?
No.
I'm sure somebody looked into that. But, so are any of the funds from that available to monitor this? The funds for the
that
solar field?
I don't believe so. It's the town budget. But we were having methane before the solar panels were
Right.
on the site. The good thing about the solar panels is that it removes the grassy areas with the loam. They had to put stone down, so that allows some gases to come out before it goes under and through, so there's less impermeable loam on it. But if anything, I'm not the scientist behind it, but I don't think it hurt the situation, or I'm not for sure, but if anything, it may be helping, but they have to be monitored. And yeah, if we had an issue, they may look at that, but I don't know if we could set up that correlation right now that it's the landfill solar units that are causing any additional issues.
Well, and it was reviewed and approved by the state before.
That is
I mean,
correct.
Yeah.
So it's,
Okay.
I mean, they authorized it to be done, and they're the ones who let us know what we have to do if we have high test results or.
And is that energy sold to, who owns the solar panels in there?
It's a Ameresco, I guess, right?
Amoresco owns it, yeah,
Owns
but
that. I
it-
think
yes.
the town does get some money.
Yes,
I don't know
was
how
gonna
much.
say,
I believe
it
it's
is.
The town
200.
does have solar panels on multiple properties, and the town
No.
does receive credit
Besides
for-
whatever the energy they generate, they give us a certain percentage of money to the town. That is the contract that I remember.
Correct, we
Energy
have a,
credits,
we do have
Yeah,
multiple
but
buildings
that may not come
here
to
in
the
town.
Board of Health budget, but it goes
Oh,
to
it
the
does.
town
Okay.
general
Yep, it
fund or
offsets
whatever.
utility bills.
Yeah.
Good discussion, though.
Mark, just in your opinion, I know that this was the lesser of the two potential options as far as the money goes. Do you feel this is gonna, remediate this problem?
Well, so far it is. We've seen less issues with gas escaping. Like I said, we have that one gas
Yeah, there was
monitor
one
that
that
shows
was-
up all the time, it
Right.
seems like. And our consultant, as well as DEP, said just keep watching it. They're not gonna stop us from testing monthly at this point. They want us to keep watching it. And it's hard to tell what's going on underground and why this one. I went down to the site and sent a notice off to the engineer that's reviewing our landfill on a monthly basis, as well as Jennifer Ball, our assistant town manager, saying, well, we have a high-pressure gas line closest to that monitor spot, a house down, and it's where the roadway goes in for the access road to the solar panels, and the question was, is that a potential issue without spending a lot of money on because when the driveway went through, they had to move, the collector point is there, but the pipe goes all the way over to the pipe that goes up into the atmosphere with the
Mhm.
top cover.
Right.
So I don't know if there's a pressure differentiation that could cause the issue. Again, that's for the scientists, but I wanted to get down there and just see why this spot, you know? It could be a fracture in the ledge that might be causing it too. It could be anything. But, you know, I was just trying to think it out. And again, it's not a serious situation according to our engineer and the state, but it's unusual that it's just one area that once in a while pops up and sometimes goes away to, then shows up again,
But
so.
we had more positives on more wells prior to
Yes,
mitigate, right?
that
I mean,
is
So
correct.
it eliminated most
Yeah,
of the problems,
yeah,
just one is
yeah.
still.
Back 15 years ago, we had to drill holes in our manhole covers out in the street because the levels were high enough to be concerned about those popping up, so, which solved the problem. The minute we drilled the holes into these manhole covers that just cover over a structure for stormwater management, gases started going away. You know, stop, the whole purpose of checking this is so the gases don't collect and cause an explosive issue.
I know we are spending sizable amount for this monitoring. Maybe we should think of something where we do an automatic monitoring rather than these people coming up and checking out and getting the money every time. So if there is a device that's
I think
available
we're
to
required to have an LSP.
mount it on these things, and then that should alarm us and say it's available, the things.
Yeah,
Good
that's,
idea.
I
Could
don't
be.
know how expensive that might be,
Well,
but
well,
it's-
probably we should look into it, and then if it's reasonable, you know, if it costs
it
the
costs.
same amount as
yeah.
2 years worth of monitoring system, then monitoring well, probably we have to do it manually, but rest of it, maybe we should
The
be able to do
monthly
it.
is 700, was that?
I was just gonna ask how long we have a contract with them. and-
We have it for 3 years, and it's required by the state, but the monthly testing, including the lab testing and the collection of the samples, is around 750 average per each month's collection. It'd be interesting for a price comparison to see if we could put some kind of probe in there that could send a signal off. It'd be
I was
interesting.
gonna say, even just to
It'd be
look into
interesting
seeing
to
if it's
see.
allowed.
I mean,
I mean,
Yeah, or if it's allowed.
I
That's
mean,
a
because
good
at least
point.
if we have a couple of year contract, I mean, at least if we know it's allowed, we could work.
work through it and
Yeah.
then
Yeah.
see whether on the long-term benefit is to save the cost.
Great idea.
Yeah.
Plus, it also.
Who would look into that, us or Mark? Or-
Well, I just wrote it
I was
down
gonna say, usually
to
Mark
ask.
does it, I
Okay.
mean,
I can
Yeah,
ask.
the
our
other thing is that it
engi-
probably doesn't depend on the person who monitors, because it automatically triggers you when things are high or low.
Well,
So it
Diane
tells
brought
you.
out a good point just now. Were you gonna say
well, I was
about
just
the
gonna say to
LSP?
Judy, I mean, even though like Mark is, you know, look into it and whatever, I mean, like if you did, you know, found another community that had it or something, I
Yeah.
mean, just send the information along to Mark
Okay.
and
Yep.
then he can follow up with it or contact the state or.
Yeah, and the point you made too, which I thought was important, no matter what, we need a licensed site professional to be overseeing, the landfill results, which is the engineer I keep bringing up. It's required by state code,
Mhm.
so.
Yes.
But it'd be interesting to see if there's a better way to do it.
Sure.
Yeah.
Good idea, KJ.
Someday we'll put those in the restaurant refrigerators, the walk-ins. I've always thought, put a camera every so often, I don't know if they'd like that, and put various probes throughout all the refrigeration. I hit a button and I'm doing an inspection for that time period.
Are you,
So the-
are you a licensed site professional?
No, no.
Is that an
That takes
accreditation?
5 years in the field,
Okay.
it's quite a bit. I was thinking about it about many years ago, but it's a long commitment to become a licensed site professional.
Okay.
When my wife used to work for Genzyme here, and the refrigerator goes down on temperature, they automatically call on weekends and emergency when different people carry phones. Temperature is
We
down.
have it on
come
our heating and air conditioning, it might make sense to have it on our gas
Yeah.
monitoring.
Yeah?
They
Put a
don't
nest on it.
So it's possible that our
Yeah.
device
Yeah,
which
no,
takes
it's-
care of it.
Just back to what we were talking about the vaccine management,
Yes.
and I'd be willing to sit down with Nancy, I know, I'd like to put together like a plan of how we're gonna implement a new program.
Yeah.
Cause obviously we're getting the refrigerator, we need to,
Yeah.
I don't know if we've gotten the approval
Well,
from the state.
and then the state, before they will come out, you have to have that equipment, so that's why
Okay.
we have to get the equipment first, then the state comes out, visits the site, makes us a vaccine provider for childhood, then we're given the permission to receive the free vaccine, since if everything falls into the categories we need to. I may add too that, and I might not have mentioned this, and I'd like to put a thank you out there to Dr. John Reap. He's a pediatrician who served on this board a little bit back, and he was, I know Ron would have helped too, but he just happened to be available and signed our written orders for the vaccine, so
Good,
that was
great.
done as well.
Wow.
You remember John?
Oh, yeah, absolutely, yeah, I didn't, yeah.
So
Yeah, I
we're
mean, I guess we
moving
can
little
time, I mean,
steps.
cause I mean, like, we have storage for this, and we're gonna just
Yeah. One
stack
other-
them in the other room, whether.
Yeah, we're hoping up here so we don't
Okay.
have, but again, we'll have to ask you guys where you
What-
want us to put these units.
keep track of the number of needs all the time, so we need to
Right.
generate some kind of a
Yeah.
tabulation to show that we need, and then we need to
Yeah.
service that category of people.
And.
Well, I would
yeah,
assume
I
that
agree.
I mean, we've talked about this before, and I assume that it would be basically August.
We're hoping, the only issue is, I don't know when the school nurses get back to the school. That's what we were talking, Laura and I were talking about that, so if they're not back like the first week in August, and if people are calling them, they could come in a bunch. You know, they
Well,
may get
because
back
when-
to the schools and see like 10 people had requested
Right, because when Nancy
vaccinations.
had came and presented to us, she had said that it was entries into school, so I'm
Yes.
assuming this would be a September,
Yeah, beginning of the school.
from people
Yeah.
that were not insured or underinsured and needed vaccinations for the children to get into school, so that's how this all came to place. We have a nurse who
Yeah.
works 5 hours a week for us, so she's gonna be the one who's gonna be doing the vaccinations.
Great.
So, and I mean, it's good to get the vaccines free from the state, so KG was kind enough to purchase a freezer so we could get, we
Well,
could
they
get
want
that.
the money, they
So it's,
purchased.
yeah,
They did the labor of search, I only gave the money.
Mark, is there
That's
a
the
site
important
plan?
I was gonna
for
say
this?
that's the most important part.
Is there a
Well, we're
place?
thinking we might have to use portable curtains in here, or if the school's in session, try to get a commitment from the school nurses to
Nurse,
help
right,
out.
that sounds
Yeah.
Well,
smart.
and that's why I asked for a plan, because I remember, I wasn't
But then when
at the meeting when the board decided to move forward with the vaccine management program, but, there was a lot of questions on that, because
Right,
we sent the information to the school department, because even though we have a service to provide, it is a school department issue as well, so collectively, we should be able to provide a service. So if they're, and it is, I mean, it's a lot for one person to do
Right.
paperwork, and if Laura's busy, so, I mean, we may need, that's why I'm looking for a plan, because we may need assistance. We might have,
and we
she
may
might
need a
have,
bunch of refrigerators at each
no,
different
but
place.
she might need some
Right.
extra staff to come here on a Wednesday night, maybe to help with, if there's, a couple of kids in each family, or
Yeah.
we don't really know how many we're gonna,
Ideally, it would be
Target,
nice
right?
if we could go to the head nurse's office at the school. We have the methods to transport, we have the ice packs as well as the frozen packs, and we have the cooler, because we had to do it for H1N1. Problem is, their refrigerator is a household refrigerator at the school, which they're allowed to use for their purposes, but for childhood vaccination, very strict. We'd have to keep controlling the temperature, bring it back to our refrigerators after the clinic, which can be
Right.
controlled. It can be controlled. You
Right.
use basically,
it's a good idea,
it's the
though.
same way that they get delivered. They get delivered with cool packs around them and then ice packs around those. It's amazing. The packages come in a day later and it's still frozen ice packs, and you've seen it in the big,
Yeah.
thick coolers they give you. We even have those on hand if we need them.
Well,
We use them
maybe,
in
maybe if
H1N1.
you or Nancy reach out, I don't even know if they're still physically there, cause school ended, but, to Audrey to see, like, to put together a plan on how we're going to implement this with, if somebody calls, this is how we're gonna do it, so we know if we get, if we're getting, 15 kids or something, then we can get some other resources.
So these units are, the refrigerators are all secure, in a secure place, I presume, right? The lock and key?
Yeah, oh, they have to have lock and key, yeah. In fact, the freezer's gonna have a lock and key as well.
When you give out vaccines, you have to do HIPAA disclosures as well, right?
We have to, everything's confidential,
And,
pretty
and so
much.
that just, there's record.
That's
keeping
why
involved
it's
in that.
better at the school, I think, than having them, we could set up somewhere downstairs in the basement. We've done that before with vaccinations, for flu vaccinations, but this is a little different.
So do they have a power backup unit for these refrigerators or not?
That, we looked into, that's gonna be expensive, so we'll see what they say. Now, Jen Ball, and maybe you know, said we may or may not be getting a generator for this building. If we do, that would be fantastic. If not, we may need to keep our refrigerators while we have childhood vaccine at the schools that have a backup generator, so we'll see.
I'm
I
not aware
don't
that we
do-
are, but no.
She mentioned
But
it
I
a
just-
month ago, and I'm not sure
Yeah, and
where it
I'm not too
stands.
sure the planning, even if they were, I'm not too sure if the reason why they have it is because we have an ejector pump, or is it because,
Yeah.
I'm sure they're not gonna do a generator just because we have refrigerators, I'm assuming it's for
Yeah.
other reasons, but for heat or.
Current day and environment, you get large batteries which can supply the power.
They're expensive.
Look into it,
Yeah,
find
oh, I
out what the
did.
cost is, we'll see whether somebody can write
They're
off.
sending me emails. I'm on, oh, okay, I see. I'm on their email list already.
But
They sent me
even-
one
I mean, there
today,
are- but-
reminders.
But I think even a one-page plan, this is what
Sure.
we're gonna do, this is what we're gonna do,
Yeah.
we've looked at
Nancy's got
alternative.
that working on the respect of what she needs to do with the state, but we can
Great,
put
yeah.
that together
Yeah,
as
and I
what
mean,
we
if-
need to do with
I
the
mean, it's
town.
probably one
And
page,
look
but
into the cost of the battery if there is one.
No
There's
cost.
compact ones, and find out how much it is.
he's saying if we lost power to hook up.
Oh, sure, no, and the state's not gonna let us do this unless we have something to have backup power, obviously. So, that's where it may end up being an issue.
Nowadays,
Well,
it's
and I
going
just,
down.
with that said, I mean,
Sorry.
with that said, I mean, I appreciate your donation, but we may
Not me,
want.
but.
No, your financial donation, I mean, we appreciate it, but let's make sure we have all the ducks in order before we buy a refrigerator or a freezer and not be able to
Definitely.
carry the vaccine, so, you know, let's,
Yeah,
you know,
Definitely.
we have the money, we don't have to spend it by June 30th, so.
Yeah, yeah.
yeah.
So let's just make sure that we know that we're going to be able to do this and get approved to do it before we,
It's better to get the information and then digest and find out what we can do, what we cannot do.
yeah.
Mhm.
Thank you,
everything,
Mark.
Mark?
And that was the budget too. Any questions on either one, or?
Judy, do you have any questions about the budget? Probably a lot to look at all at once.
No.
Well, just because Judy's new, on the second page, I believe it is, there's revolving accounts. We have a
Yes.
couple of revolving accounts as well for tobacco and for the food establishments. So those were the fees that I was talking to about earlier.
Oh, okay.
We'll probably review that before the next permit season. A couple of these accounts don't apply to us, but the food inspection program and the tobacco program of ours.
So
Yeah.
those are revolving accounts?
Yeah,
Correct.
and
Okay.
the upper ones are what get taken out of the.
There's expense and
the
revenue.
line
yeah.
supply, and the other one is the expenses, the you're right, the money coming into the, side. So you see different line items for it, but we've spent 21,000 on the food program, about
Right.
22.
Yep.
We're 5,466.06 on tobacco this year, but if you go to the base, where it shows you the other numbers, the fives, those
Those
are
are the
the,
expenses.
yeah.
Those are the expenses.
So, that's that. And we have a tobacco agent who's right now considering retirement, and we will be looking for a new one. We're working with Human Resources, our food inspector is Tom. And again, we're looking at creative ways to budget for additional food inspections, as mentioned earlier.
Okay.
And I acknowledge, I already jumped to 6 beforehand. I didn't know I jumped to that, but thank you, Katie.
You're okay,
for-
Mark, you're skipping around today, that's okay. Number 7, the Nyanza advisory update, I assume you wanted me to?
Yeah, I didn't go through
Okay.
it, so.
So again, Judy, just for clarification, I was appointed as the member of the Board of Health for the Nyanza Advisory Committee, so I attended the meeting. It was not, it was right here, it was televised, it was not well attended. It was the, as they call it, the 5-year review meeting. They did a great presentation for the people watching at home. An overview of the Nyanza site altogether, from start to finish. It was a PowerPoint presentation. Again, it was very thorough, which I thought was good for somebody new watching it. It wasn't really conclusive though, like I don't have anything big to report. It has to go through certain channels. So basically with the 5-year review, they will report back to the Nyanza Advisory Committee, the community, on any future plans, testing, monitoring wells, if there's any issues, how they're gonna address them and so forth. So it was more of an overview than a conclusive report,
Okay.
but they did a really good job, and it was televised a couple of times. I did see it on WACA, so.
We were discussing that. I have ready to send to the board if you so wish the PowerPoint.
Great,
I can
yeah.
do that.
I mean, yeah.
And they met with me prior to that meeting to do the same thing, go over the 5 years. And it's actually a performance review too, more or less of their performance. How have they done in communicating with the community and so forth. So, and I told them, as far as I'm concerned, they've been doing a fantastic job. I don't have any concerns related to their
And they will be having a public forum on that, basically to literally get feedback from the public as well as, the members of all the departments. Again, because they're being reviewed as well as the site, just to make sure that everybody's in compliance. So I think it's nice that they review that every few years, just to make sure everybody's on the same page.
I like that.
Yep.
Did they ever process further on that limitations on digging in this area for water?
They didn't specify it. The only thing that they did get into more specific details on is they were saying.
Not the DEP or EPA, but I meant the Nyanza committee, because they were planning to introduce an article for the town meeting to restrict people from digging wells in these areas.
It was my first meeting. The purpose of that meeting was a 5-year review, so they didn't, we don't have another meeting scheduled, so I'm not aware that they're moving forward with something like that.
Okay.
But what I was gonna say is that, they reviewed for the public that, some of the elevations in the plume are still higher than they anticipated. And in the track area, they have limited access
Right.
and permission to dig near the tracks, for obvious reasons. So they're not too sure if
What's the-
there's pooling, if you will, that's my terminology, I don't remember theirs, but like pooling, in, near, or around the tracks that could be keeping the contamination level where it is. And of course, we all know in that area, everybody has, the properties have mitigation systems, so it's not a concern of that nature, but they were expecting the natural decay of it to drop a little bit, and it hasn't as they anticipated. But because they can't drill directly into the track area, and again, there's a limitation area, they're considering, and again, this is part of the review, they're considering
A lateral digging.
correct. So that's part of their review, just to, I guess, know the answer. So that there was it's an idea, but it's
Right,
not
right.
specifically gonna be done.
I think they should probably start injecting hydrogen peroxide in all the area to eliminate all this plume area.
Was that even spoken about at all? I know, John would always beat that drum, that we should get it out of here, but nothing like that is talked about, is that?
I mean,
No,
John was actually talking about the contents of the Nyanza field, he wanted to transport, not
Right.
keep that. And also the landfill,
And
take it
landfill.
out,
Oh, I
that's
didn't know
what he was thinking
Oh, the
about.
landfill too.
What's
Oh.
there underneath the plume,
Well-
underneath the ground is going to disrupt all the residents, that's going to be a problem.
I'm not an expert, but let's not poke the bear. I don't want to
Right.
create a problem that's
Right.
not
Oh, no,
existing
no.
right now. They did not,
Yeah,
they did not,
say, yeah.
no,
I-
they didn't talk about
Yeah,
anything like that.
God knows how much money that would cost. I'm sure
Yeah, and I mean, they did,
And
talk
somebody
about the
should be
solar.
willing to take it too, your problem, so.
Yeah.
Well, they did talk, I know Judy mentioned about house, I mean, they did talk very little bit about the proposed solar project, which again will have no impact to the cap. It's under review, but they're moving forward with that
Mhm.
Yeah.
process, so. That's pretty much the update.
Yeah, and there's still, it's OU too, is the groundwater vapor issues in the center of the plume, in the area of the plume, so. And they continue to try to figure out the best way to handle it, and right now they're venting any basements that might have a potential for the gases to get into the basements with vents that you'll see on houses, as well as they're looking at the two pot zones. As it relates to the potential for some type of a bylaw for digging in the area of the plume, our legal counsel has indicated it can get difficult to do something like that, so I think that's on hold right now for further legal review. That's what I
Yeah.
heard. Yeah.
Well, incidentally, there was some inspection done in the police station and the fire department, remember about 6 or 7
About
months
2
ago?
years ago, maybe?
Yeah, no, recently.
Recently,
About
too?
7 or 8 months ago, you were there and we were there.
Yeah, was that-
Did they come up with any remedies or
Maybe
is
it
still?
was last fall. I
They-
know it was in the
they-
fall. I
They
thought it
did
was-
not end up, they were considering installing monitoring well, and they did not
Oh, I didn't
install
see
a
enough
monitoring well.
evidence to do it.
I was gonna say, I think it's because of, I don't know what the results were, but I mean, that there wasn't a need to put a monitoring well.
Okay.
So, the plume pretty much ends right near here, and it's the,
Keeps moving.
that's the thing, and it's a living plume.
Right.
And it can change, either it can shrink, which it has been, or it can expand, and it's based on the weather, the rainfall. So that's why it's difficult to set a perimeter. And I think that's what our legal counsel was trying to say, well, what if it moved in? And so it's difficult to say the plume exactly ends right here, and that's what brought that study up, because someone put a green light, I guess, so there was some lights, covers for lights that we even had in the parking lot showing where the plume was. And it was past where the plume was, but that's why they tested the fire and police, just to be, the state came out with the EPA to test that, just to be assure anyone in those buildings what the
Same.
numbers were for the.
And for clarification on that though, but, I mean, I don't know what, like I said, I'm new to the committee, but I don't know what they were looking at doing, but there are restrictions in the plume area
yes,
for digging,
yeah.
period, so were
Yeah.
they, I don't know, were they considering in addition to what the restrictions are,
I
do you know?
think it was
No,
that you
the-
couldn't dig any.
The only restriction is that if you dig, you need to probably go through testing processes, but now they wanted to forbid that, digging itself.
So if you're
This is,
digging.
this
I
is
think
what,
a DEP
this is what the
regulation-
Nyanza report had recommended
Oh.
way back, and we had
Okay.
not acted on it. I believe one of the towns in Connecticut did apply, did
That is
enact
correct.
on
It
it.
was.
Yeah,
So
I'll
that's
look
what
into it.
we're trying
First
to
I've heard
do.
of it, but yeah.
That's why the entire committee sat down together for 9 months to generate
Yeah.
15 pages of the bylaw and then didn't process through yet.
Yeah, and the other, as Diane noted, it's not that presently if you decide to dig in the plume area, that the way it works, because our water department sometimes has to dig in roads that are close to Nyanza, the process is if you detect any issues of what may be a contaminant, no matter where it's coming from,
E21.
you immediately have to call a licensed site professional who would come on site, test, evaluate. They got these meters called H-News that can pick up a lot of volatile organic chemicals that are volatilizing while you're excavating. And sometimes they'll require that before you even start excavating. So there's different methods for protection at the present time. And again, that bylaw would have been above and beyond those present measures to help out.
Mark, I don't know enough about the Dig Safe program to kind of figure out, but is there any kind of a tie-in at all to where, you know, if someone had to call Dig Safe because they wanted to dig anyway? And I know traditionally that's really for electrical and power lines, right? But
They're not connected to the Nyanza plume in any
Uh-huh.
way, but
You're saying if
it's
somebody
part
calls
of the
dig
process.
safe to put up a fence, did they notify
yeah,
DEP?
that kind of
Yeah,
thing,
no, not
Another
that I
good
know.
question, yeah.
yeah. I mean,
Yeah.
is Dig Safe a state-regulated agency, or is it just the outdoor companies that?
Gets complicated.
I'm not for sure if they're state or fed, but
Uh-huh.
Dig Safe is very much
It is a
throughout the
state.
country. It's state, in each state, yeah, it's a great program.
It's a good
Because
question. to see
your
if there's
digging
a way-
shouldn't affect the public use of the existing pipeline, and if damage it, then most of the people will not get the power or gas line. So they want to make sure it's safe for them.
I mean, at the very least, it could be a cross-check. They
Mm.
can inform us, we can inform them.
Yeah.
We can,
Yeah.
Is it
Uh,
dig safe done through the DPW?
No,
I'm gonna
Dig
look it
Safe-
up right now.
yeah,
'cause-
dig safe is a private
Yeah, they-
company that you
Yeah,
contact.
they have them throughout,
but-
like, I just went to type
I mean,
it in.
DPW would call them on our projects.
Right, but DPW would be called in when dig safe is called, they're called in to
That's
mark
right, for
any,
water
mark
lines.
any water lines or
Yeah.
anything like that. They are
Yes.
also called as part of dig safe. So can we maybe coordinate with DPW if we mark an area and if you get a call within this area, kind of thing?
Yeah, I don't see why not,
We'd
right?
have to find out, but the issue is, they're not digging in to interrupt a pipe or anything, but they possibly could discover a contaminant, and they may not, you know, even, there's been digging that has gone on Nickerson Road, and they didn't hit anything. I remember dealing with Doug Small from the DPW, but if they did, that's when they would have to call a licensed site professional.
Well,
But you,
what I'm saying is, there are zones where you're not supposed to dig as part of Nyanza. Is that what somebody is
You
stating
can
there?
actually, no, you can dig anywhere you
You
wish.
dig anywhere you want.
There-
So,
there's-
can I dig a hole over on Cherry Street?
Yeah, but we,
Nobody would
if you
stop
go to
me?
do it, we're gonna
You need
tell
to
you
test
that
this
if
one.
you discover
but
any
if somebody was
issues.
putting up a new house, we would refer them to the DEP
Yes,
before
and
they could
right,
do it.
yes, if you were if you decided to dig on your own, I wouldn't know. But if you were digging and you notified us, that's exactly what we would do, refer you to the EPA and a DEP.
But it is a legitimate, if you were to put up like a fence and do it
Yes,
yourself and didn't
yes.
require a permit, obviously it's a risk, and if you're within the plume area.
Right.
But what you're saying is if DPW get calls to mark out a water line,
Right.
and it happens to be on Magunko Road,
Right,
they should
they should say.
make sure, just a notification, maybe something is not,
Is there somebody we can contact at
right.
EPA and say, somebody is requesting to dig there.
Well, maybe,
I don't know, like, if
Find out.
there's, if
okay, maybe we
you're
can
not-
ask the DPW director how we could implement
Yeah.
that through, like, maybe they have just a,
Cause they
a note
are
they can
called
put
as
in their
part of
system.
DigSafe. They might say, no, I know I don't have anything there, I don't need to go out and mark anything
Mm.
for you, but at least we know, that would be our connection to it.
right,
Yeah, that's a good idea.
Yep.
If in the pool.
another good idea.
I'll ask the question, I'll send
Yeah,
some-
Doug might have a
I'll
good
send
idea
that
about
to Doug and see
implementation,
if
yeah.
that's a great idea, it's easy.
Yeah,
You know, just so you know, you're in the plume area, if you
Doug
discover
likes new
anything,
projects.
it's just like coloring in a map where the no-dig area is, and if they
Yeah.
look at it, and it's there,
Absolutely, yeah.
another step happens.
Keep going?
Yeah, I actually got through A and B.
Yep.
B, Tom did that.
Yep.
And then, and E
DP
I did as well, so
Okay, so
now
just
it's just
C.
C and D. And, with C, I had a meeting, we had a meeting, the DPW, they are wanting, with the school athletic director and an associate that helps out in the fields, and cobblestone, and, landscaping. And we all met with Ed Hart, who was, one of our board members here, knows pesticides inside out and organic pest management. And the issue the school was having is one of their fields is the softball field in the back area at the high school. You can't see it right from the high school, it gets its way in the back, is having trouble with grubs. And they were looking at different methods. Their pesticide idea was, or pest management was possibly using a product that wouldn't meet our code, our requirements. Our requirements say you can't use any toxic levels 1 and 2. And Roundup, which is the name of a product, is very concerning right now, and so much in the news that Ed was kind enough to go forward and research what could be used that would be safe. And he gave them some ideas that Cobblestone started looking into too, and that's what they're planning to do, is use organic type pest management for the grubs. So
Thank
it
you,
worked
Ed
out
Hart.
very, yeah, thank you. He might have been here. I did ask, but I can't ask him to be at every meeting.
Right.
So, but it was a good meeting. Ed found a solution which was even better, because if you don't, I did explain, and that would require a waiver from the board, and they would, and I told them it would be hard for the board to allow you to use a toxic 1 or 2 on public fields, especially now with all the information we're receiving on these issues of using toxic pest management. So they were all great to work with. I suggested we do this every 6 months we get together. And in 6 months from now, we'll be at that point where the DPW is figuring on what they need to buy in supplies for their budget for the following fiscal year, which we did when we first set up these pest management regulations. We actually met in the winter so that we could help out the DPW with their budgeting for the following year. So that's what we're planning to continue to do.
Yeah,
There
but
was-
I think it may be helpful if we can list those things on a website somewhere, so if private guys wanted to use it.
Yeah, it is on the website. Oh, but the
Oh,
new
the
product.
one, whatever the new product that
Yeah.
Ed Hart has found out.
Yeah,
So
well,
it probably-
they're gonna test it. This is one thing,
See if it
there's a
works.
little
Yes.
doubt. There's a little doubt, but I think it's gonna work.
Okay.
But I agree, if we can just wait and see how it works,
Sure.
and then we'll go from there. It's a matter when you apply it,
Mm-hmm.
and it's a matter of how often and you apply it. You have to apply it at certain times of the year for it to be effective. Cause I even was planning to try to buy some product of this nature too, and see how it works on my own lawn. So we'll see, but there's some substitutes out there, and then if it is effective, then I think that's appropriate to
Mm.
list it, Not a recommendation, just a product that was used as part of our pest management program. So that's a good idea. And just so the board knows, we had funding in our public health emergency preparedness program, which covers 60 cities and towns in this area. We're called Region 4AB. We used to be Region 4A, now we're 4AB. We picked up all the towns around Boston except for Boston. And we get budget, within their budget, they sometimes, this year, they had excess budgeting we didn't have the need for major emergencies. So We're looking at supplies, and they offered a couple supplies, one of them being Stop the Bleed kits. So they should be coming in very soon, just be on the lookout, they're large boxes. And we're also getting other items that will help if we ever have to shelter, such as personal items in a bag, basically, that you can give to someone if they forgot their razor or something of that nature, a bar of soap. And then we'll, the one I'm very happy to see is and I mentioned it too, one firefighter who offered us first aid training last Friday, was that hopefully after, I'm gonna speak with the chief, the fire chief, and the process would be, without a buzzer going off, is to put it right next to the AED, the Stop the Bleed kit. More and more people are talking about Stop the Bleed, and that way it would be available if something drastic happening, you needed to use a tourniquet or the gauze, and so forth, and continue to have training on it. The town has been pushing more training with the employees, and maybe we can get that word out more than just in town, but I think more and more people learning. I don't know if anyone's had a Stop the Bleed overview. I'm sure the doctor has.
Yeah, I hope so.
I was gonna suggest maybe we do that at our next meeting, put it on the agenda,
Yeah.
just discuss what it is.
Yeah, you bet. I'd be, I had the training from a nurse, so it's another
Do they
opportunity.
cover Stop the Bleed in the first aid and CPR training that the fire department offers?
To some degree, yeah.
Okay.
It's,
I was gonna
he
say,
had
I know that
small versions of each.
Taking it. Next
But-
Thursday night is their first aid class, and
Oh,
that might, I mean,
yeah.
if
He
there's
did.
enough available, it
Yeah.
might be a nice gesture for the people attending it.
On the topic of Stop the Bleed and bleeding in general,
Oh, Jesus.
I only bring this up because I remember back when I was in high school in the late 70s, we had a kid who had hemophilia. And in order for him to attend school, he had to sign a waiver, and his parent had to be there at all time. Hemophilia is a clotting, a thing where blood doesn't clot properly, and you could bleed to death with a simple cut. And I haven't heard of hemophilia in decades. Does it still exist? Is there just a smaller number of people with it? Are there?
Yeah, it exists.
Uh-huh.
I've had one or two people in 30 years, but that's,
Yeah.
We have a pretty healthy population.
Yeah.
It's not that large of a prevalence,
Mhm.
but, if you need to do something, then there's clotting factors and different ways that.
Yeah, if we're talking about Stop the Bleed and someone encounters someone with hemophilia, it's gonna be a whole different situation.
Yeah.
How many kids are we getting, do you know?
7.
Oh, wow.
So
Oh,
I'm
so it's
hoping-
actual, I'm sorry, I thought they were personal, I
And
didn't
we-
realize they
well,
were for
no,
the.
they're kids that'll hang up on
Okay.
the wall
Sorry, I thought you
somewhere
said
if we
personal
can.
kids,
I
yeah,
gotta go
yeah.
through you guys and make sure I can. But it's becoming more popular, and then we're getting some bags to carry as well
That's
as.
good.
And one of the most important things in any kind of first aid training is call 911 first. The reason for it is that the fire department, the rescue workers have, as Ron noted, other ways to stop bleeding. But one thing I learned in my first aid training, if I may take 2 minutes, is that for nosebleeds, I remember when I was a kid, I had a cousin who used to get them all the time, and she put her head back, and they trained us in the course I just took that you don't put the head back on a nosebleed. You pinch the nose in 10 minutes, hopefully it stops. Obviously, if it doesn't, then the one thing I remember him saying, don't be embarrassed to call the rescue people to get out there, because if it doesn't stop, it will need a doctor probably to cauterize. But I didn't,
What,
the
no,
head
no
part.
brown paper bag under the lip? Remember that one?
No, but in a cold pack too, they said, and I'm not a medical person, I'm just giving you a little overview of what we had in our first aid training, thanks to our human
All
resource
the wives'
department.
tales when we were kids.
But it was very interesting, because I wouldn't have known that. I always thought, put the head back, but no, it causes bleeding, the blood to get down into your stomach, and that can be a problem. So, but I thought that was very interesting. Again, I'm not a doctor or a medical person, but that was an interesting tidbit I never knew about.
In India, they suggest to put a wet, cold towel on your head, cool down.
A lot of interesting ideas, information came from that first aid training. And that's it for me.
I have one question, if we can get some answers next time, that'll be nice. We did send a letter to all the vendors about upgrading their anti-choke numbers. We need to know how many people did act on it and get something, so maybe come down to the office and then look
Get
at the
a number.
sheets if they have updated it. If not, we may have to
Who has
call
updated
out on them and
information.
find out how they're doing.
Another very important course to know, or.
Yeah.
And speaking of that notification, just so we have it, you know, cause now if vendors are buying flavored products or, you know, the menthol, do they know? Has everybody been informed that,
We were planning to send the word out. Elliot, the person that still works for us,
Yeah.
was going out to point of sale to discuss what's required and what's in the future. He hasn't gone out as of last weekend, but I expect he will be, and I'll make a note to him to maybe we can hand him 17 of our regulations to leave there.
it'd be nice
And then
if
we
he
can
could get
re-emphasize it again.
acknowledgement of receipt of those, just so
Yeah.
that he can come back and say, we didn't tell you.
Yeah,
Right.
yeah. good
Plus, I
point.
think you have the electronic file anyway, so you can email them too.
Do you want to wait until we could do one better than that if the board so wishes, is we could notify them in September. There could be some changes to these regulations, send them to them with the letter of invite to it's up to the board.
You
I
know,
don't wanna confuse them.
And I get that, but I feel like that we've already have a signed document
Yeah.
that is going into effect, and they should have it, they should have had it already, actually.
Yeah.
I don't see a reason to not send them the proposed
they should be
regulations for
prepared.
January
Two
twenty
different
twenty.
ways.
Every set of regulations is always
Yeah.
subject to change,
Yeah.
right?
And we can let them know that, I think if it's not done in the next week, I'm off the week after, is I can go out there in July, Kaylee and I, that'll be a project for us. And we can hand these out and talk with the vendors, when they're there. Say, these are the regulations as of January of this following year, there could be changes and you will be notified, but you need to sign that you received
I agree with you,
these.
because it's a bigger impact
Yeah.
than
Yeah.
potentially some of these changes.
Well, one of the things that we did when we agreed to make it, when I suggested that far out,
Yeah.
was to give the vendors ample time to figure out how to
Exactly,
compensate,
yeah.
for the loss, the alleged loss.
We don't have the electronic emails for them?
Yeah,
You could
did
just
we-
shoot
Well,
them
and it
out
wouldn't hurt to
electronically and then
notify
go
them multiple
afterwards.
different
Okay,
ways.
we can do
I mean,
that
we have a
tomorrow.
tobacco agent, he should go
And then
visit
we'll
them and let them
handle
know.
it.
Maybe in September, send a reminder,
Yeah.
email, November, I mean, just
Yeah, that's smart.
a few, because then we can't.
It would be nice to have a
Yeah.
signed document that
What
they
we can do
receive.
too is tomorrow, we'll send out the electronic version of it, and we have their emails,
Mhm.
and we'll have a return receipt
Yeah.
as part of that.
Mhm.
So that'll be the first step. The
Okay.
second step will be hand delivering them.
Sure,
And tomorrow we'll propose an email that says if you have any questions or concerns, they can call me,
sure.
because we're in transition of that tobacco agent.
Mhm.
So that would,
How many of these?
17.
17. It just seems a lot if we're emailing them that we have to actually go out and hand them as well. But
Well, maybe we don't,
certified
maybe we'll
mail
see
or
if
something,
they-
it seems a waste of Mark's time to,
Yeah,
Well,
maybe we come back,
visit
if they call us, then
17.
we'll go out,
Yeah, I mean, it is a good point, I mean,
it's a good point.
I mean, do we, send them out certified mails, do we send them just
I think
electronically?
certified mail would
I
probably
don't-
be
I mean,
a
we're
lot
in the
cheaper than
transition
his
of the
salary
agent,
on
the
it.
tobacco agent, so that's the only concern I.
Probably cheaper to FedEx them or UPS them than to do certified mail.
It's like $6.34 to
Yeah,
certified.
well,
so-
whatever it is, yeah.
Closely.
But certified.
I told her, listen closely, I
Oh,
don't
no,
know
that's,
which
I
one
mean,
we're
it's
gonna
just, it is
use.
food for thought, because it is,
Yeah.
it is time consuming to,
35
for Mark
is-
to go out and.
Yeah.
What,
Right.
maybe we should make that the first attempt is, or the first notification is certified mail to all of them,
Okay.
and then
Mhm.
maybe
Yeah.
by that time we'll have an agent, and it will be a good thing for them to go meet the vendors,
Right.
talk to them about it, educate.
Right.
It's
Good idea.
Good.
Unless, do you think it's
Cruising.
advantageous to have, a certain set aside time and invite all the tobacco vendors here? Or you think that's
We're
not-
probably gonna have them here in September,
Yeah.
potentially, to talk about any future changes, so we could also reiterate it then.
Incorporated in that?
Well, and
Yeah.
remind them
Or
that
remind
in
them.
addition to, this is what we're proposing.
Yeah.
I mean, the other
Okay.
ones are already going to be effective, so. And again, even with that, even if that's in September, we could, have a public discussion and then still
Right.
notify them of anything that's going to. And you don't want anybody to be caught off guard.
Yeah.
All right. Everybody get a chance to review the minutes of May 28th?
Yep.
KG, I know you weren't here. Anybody have any changes or any comments or? Okay.
As far as I can see, they're okay, and I'll make a motion to approve them as presented.
Okay, do I hear a second?
Second.
All in favor?
Aye.
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 I abstain.
One abstain.
Deb is not there.
Okay. And then, discuss future meeting topics and meeting dates.
So we're looking at July 2nd would be the next.
I will be here that week.
I was gonna say,
Oh.
I don't know why I knew that. I was gonna say, believe.
It's the 4th. I'll be celebrating.
So
It's the
we-
Monday after the 4th of July week, is the 7th, right?
9th. The 9th would be, the Tuesday night would be the 9th after the 4th of July.
Do we wanna go to the typical summer schedule?
Yeah, once.
Yeah, so I mean, the
Not there.
16th would be the next scheduled meeting.
Correct.
Is everybody good on the 16th?
Mm-hmm.
Okay, and did 6 PM work out okay for everybody? So
Yep.
far? Okay. So we'll do the 16th. Everybody, do you wanna set the August now as well? Well, we're.
Try to turn my phone.
So we usually do one meeting in July and one meeting in August, and of course, if we need another one, we can set one, but, so do July 16th, 6 PM. And maybe August 13th?
Works for me.
Mm-hmm.
13th?
Yeah, let's see, and then we're meeting the 3rd, so that would break it up a little bit, yeah.
3rd of what?
September.
Oh, I'm sorry.
I don't wanna go that far, cause then we're talking, well,
Yeah,
we're talking
but
about
it's-
good
yeah.
times for you. It's not your birthday, at least.
So if August 13th works, we can do August 13th.
Just some ideas for our next meeting topics. I think we should put the tobacco regulation review discussion on there. By that time, I should have some information.
Sure.
I certainly, it'd be easier if it were there and I didn't have anything to pass on it than to have stuff and not be able to
Yeah.
talk about it, so.
And, if we don't have any scheduled appointments, maybe we can actually set aside a good clip of time to
Sure.
actually review it and.
Yeah.
Okay,
I have a subject.
Go for it.
okay.
I don't know if this is under our jurisdiction, anything that we can talk about or not, but I'm very interested in it. I received an email today with a link to the school page. At the Minda School, there was an air quality test done that noted some asbestos tiles and also possible high levels of carbon dioxide in one classroom that was way over a limit, as well as mold, I believe. So I'm wondering, like, who is overseeing
on
that?
Unfortunately, we're not the agency that handles that. Whenever that does happen, we can be the sounding board for people and get them to the right people. It's Department of Public Health, and they have a division within their Division of Occupational Health. And that's what we call out to if there's a parent concern, and they'll go out, and they're probably the people that did it, possibly, unless they called out a private consultant. But
It sounded like some of the staff at the school called a private consultant. And
Which
the
school is this again, I'm sorry?
Warren.
Minda.
Yeah,
Warren.
Warren, I mean, I know
Minda.
it's not a new problem, because I know we've dealt with it over the years.
yeah, I deal
working-
with a Michael Feeney, and actually last year I had this same complaint at the was it last year or the year before?
So-
Right at the beginning of the school season, they were complaining about some of the off-gassing of maybe the waxed floors and so forth, and mold. And so I had Michael Feeney, and he's been with the Department of Public Health for years. He may have sent out an assistant, but they're the ones that have the laws and the controls on schools.
Okay, so it's on there, you might wanna just click
Yeah.
on it. It's a link to a report that was done. It's on the K-12 page. I can send you all the link if
And
you want.
Send us the
If
link.
you don't wanna say why, but, I mean, did you get it as a,
Well, I got it as, is this something that,
did you get, we get it?
from a
as-
citizen?
Oh, okay, you get the bulletins, I didn't know if somebody sent it to you to bring it to the board's attention.
I think a note was sent out to the parents
Okay.
to check it out, but
Okay.
I started reading it, of course, I'm not a scientist, I don't know, but it was talking about carbon dioxide levels in one of the rooms was like off the charts, like, you know, not even, you know, some were high, but this was abnormally high, and, you know, that could affect learning.
Maybe we can give you your first project. I was gonna say, well, no, but it might be worth it for you to follow that, because it's something of your interest, is you might wanna find out if the school committee has spoken about it,
Yes.
or if they're having a meeting,
Uh-huh.
just to, you know, and we might not have any enforcement, but it'd be
Okay.
nice to be all educated on what's
So
going on.
who would oversee a health risk like that in a school with air
The
and
Department of Public Health,
So good.
Massachusetts
Massachusetts? Okay.
Department of Public
Yeah,
Health.
Mike Feeney is one.
Mike
Okay.
Feeney's the person I've been dealing with for years, actually, because
And at least maybe
10
some kind
years
of
ago, we
corrective
had the
measures or
one,
something
yeah.
being taken. I don't really remember.
Yeah,
We
I
can
mean,
be
you
a-
could talk
we
to
can be
someone
the
on the school committee, you
coordinator.
could talk to Jim Adams' office.
Yeah.
Jim's come here many times
Yes.
to chat and, you know, discuss concerns,
Yeah.
so.
We have grandchildren in the school, so I
Mhm.
wanna know about it.
Sure.
Absolutely,
Yeah.
absolutely.
Send
And
it the link
I will.
without your opinion, and
Um,
of course.
I don't have an opinion. I don't,
Yeah.
I,
Yeah, it's
you
open
know.
No,
meeting, I
just for clarification, you probably aware from being on the board is we cannot communicate outside a meeting.
right.
So if you send an email to Mark, you can blind CC the board, so nobody accidentally responds to everybody.
Mhm.
It just might make it a little cleaner for you, just so you can send it to Mark, or Mark can send it out to us.
Okay.
Yeah.
So,
Are you on the page? Do you see it, Mark? Are you online?
No,
Okay.
but I definitely would, if you can get it to me in case I can't find
Yeah.
it, and I can do two things. I can send it to Mike Feeney at the DPH as well as the board, and
Okay.
then,
And
then
maybe
we'll
get an
go from
update,
there. And I
right?
can update you at the next meeting. I know it's unforeseen and not on the agenda, but probably it should be on another meeting maybe, if the board's
well, and
okay
it's,
with
I mean,
that.
even though we might not have enforcement, we could
Could
put it on a
invite
future
Jim.
agenda for an update.
We could invite Jim
Well,
Adams if he wants to.
Let's
be,
just see
you know,
what,
see
I
what
mean,
he's-
we might just need an
Yep,
update, maybe.
Sure.
Yeah,
Yeah.
I can try to get his input prior, actually.
Yeah.
Right.
prior to-
yeah, it might be
Not that I
easier.
don't want Jim
No,
at our
no.
meeting, but.
I'm sure he's got better things to do.
Well,
Um,
this is important though, so we can.
Something we might wanna talk about at our next meeting, we've brought up Ed Hart. Ed, I don't know if you're watching, but I gotta give you a little bit of a plug. Ed spent an ample amount of time, presenting to this board information on glyphosate and pesticides in general. So we should at least, I think, discuss whether or not we wanna take some action. He mentioned, if I'm not mistaken, that some towns have decided to ban the sale of it,
Yes.
and maybe that's something we wanna consider doing. So that would, at least to discuss that.
And Ed probably, and I'm thinking just for that meeting, is Ed probably knows right off the top of his head, but maybe a list of who has.
Warwick.
Falmouth is in the
It's funny I
process.
remember it, but it's Warwick, Massachusetts. I only remember it because of Warwick, Rhode Island.
Right, exactly, yeah.
But it's Warwick, Massachusetts it's a small community out west,
Yeah.
but they were the first, I think, to do it, and Ed brought in literature. And I think he enjoys coming to the board to
Yeah.
be as, like an associate,
Yeah,
so I think he'd love to do that.
Yeah,
I
I mean,
did
it's-
ask him to be here tonight, but I don't know if we can get him every
no,
meeting.
you know,
night, but-
I think we owe him that courtesy, he spent a fair amount of time
Yeah, absolutely.
presenting to us and
He
all
does a
that kind
really
of,
good
to
job.
at least have a discussion about it and bring it up. You know, I mean, the reality, when I think about the landscape of who we have as vendors in our town, it might not even impact anybody at this point.
Well, that's what I was gonna say, I mean, do we, for the next meeting, though, do we want,
We get the budget too, ideas.
well, there's some things, with the pesticide, I agree with you, but it's like, should we,
Yeah, we can put it off to the one after that, I mean, certainly within, you know, one of
well,
the
let's
next
see, yeah,
couple of
see how the
meetings, yeah.
agenda looks for next
Yeah.
meeting, if we have to, you know.
And Kaylee was gonna present, if that's.
Next
okay,
meeting.
at the next meeting.
Oh, of course you can.
No, you can't.
I mean,
I present at the one after that, actually in August, I think.
Is that okay
At
for you?
that point, I'll have like the most. to
Then I
present
guess
to you
we're all
guys,
set there, good.
And then I have to present it to the department, like the mass department the next day, so it might be like a good dry run.
Yeah.
That's great, awesome.
The board won't make you nervous, I promise.
Yeah, and I would like to see a presentation at either the next or the one after that on what Stop the Bleed is, so something to look at.
And maybe I can get Nancy in here, or the nurse that taught me, again, I'm not medical, but
Yeah.
I can go over it and show posters and so
Yeah.
forth. But I always have to make
And I
that
think it'd be good
disclaimer.
for our public to see
Yeah,
that.
yeah,
Absolutely.
I think it's a great idea.
Yeah, and back to Ed just for a minute, is I just think that, like, if, I wanna give Ed also the time to come in and actually, like,
Sure.
go over it. I mean, Judy's new, but it'd be good to, he's very, I don't know if you know Ed Hart, but he's very knowledgeable on this, and much more knowledgeable than I will ever be on pesticides. And, so, maybe if we have time, we'll have him come in, just to, sit th- one thing I was thinking, because when Mark was talking, KG was talking about the anti-choking, unfortunately, I had to do the Heimlich on somebody, and we all hope we never have to do it, but it scared the daylights out of me. So, I was actually thinking that maybe the Board of Health or Mark could go for a BAA grant in the spring, and maybe we can offer a public, anti-choking class for people, or something that's.
Do you know how
truly-
much does it cost?
I don't know, but I'm thinking that, I mean, we could get anywhere from $500 up to $2,500 for a BAA
Sure.
grant, and it would be a community offered program. Just throwing it out there.
That's great.
Anybody have anything else? No?
Was, I just forget, was number 5, was that supposedly, to go over and review and, for Mark and, whatever help he may need, or is that with Lisa? Is that what that is
Well,
for?
I'm hoping you'll get ideas from the board members on where to take the charge for the board,
Yeah, we
So,
should-
because
I
I
didn't
know,
mean
I
to
think
skip
we
it.
had mentioned
No, I
it
think-
last time, but I forget if that was specifically for that, or Lisa spoke with us the time before, right? She
Yeah.
spoke with us.
Right. Me personally, I would prefer it on the agenda each meeting,
Oh, okay.
because I think we'll just have different ideas and conversation where we are and, how we doing on, nurse vaccinations and the tobacco agent, and it just seems like it's a moving pieces, so maybe we could just keep it as a standard item to talk about every month. I
Okay.
thought we said that we were going to be prepared in September, so I think we would have to discuss it a little bit in July and a little bit in August to have a actual document for September, if I remember the
Yeah.
timeline correctly. Because I believe he said it was beginning of October, or the end of
Yeah.
September, beginning of October was the submittal, so just in case we wanna give ourselves a little bit of leeway.
Right, and I don't know how much time it's gonna
Yeah.
take to do whatever Lisa
So
says.
if everybody's okay with it, we could leave it on each agenda, so then we can talk about it.
No, that's great.
Okay.
Yeah, if you have ideas, I mean, I dropped the 2 additional personnel, but obviously that was the wish list. And,
Right.
the board may say, well, let's look at it this way.
Well, and
And that's
Michael
what I'm
Herbert had
looking for.
expressed interest in, I don't know if he continues to, but to talk to Framingham.
Yes.
So maybe we'll get an update on that
Regionalization,
as
yeah.
well, so.
Yeah,
Okay.
that would be good if we can, yeah, exactly.
Well, like, I think we also said, yeah, we would have obviously Plan A and Plan B if we're, so.
Yeah, I'll just say if indeed the considerations to regionalize, say, the nursing services, and Framingham definitely wants to join in with them on the flu shots, as we did
Good.
last year, then that would be one position we can resolve with regionalization possibly. And then we're looking at the health assistant health agent as the other position that I brought up to, the finance group last year versus 2. I know I shocked them with 2. Oh, well.
You shocked them with 2, but you picked one for us, so we were okay.
Yeah, okay.
All right, anybody have any other, items for the agenda?
Not that I know of, but if I find
Okay.
something, I'll just email it to you. If time permits, we can include it. If not, subsequent ones.
Awesome.
Nothing gets stale here.
I was gonna say, if everybody's all set, we'll take a motion to adjourn.
So moved.
Oh, seconded.
All in favor?
Aye.
Aye. Meeting is adjourned at 7:34.